Hello guys, welcome back to my channel. In this video I'll be discussing with you about what to expect within the first 5 days of giving birth for both mum and the baby. I've got some notes down here, so excuse me if you see me looking down to look at my notes, just to make sure that I'm covering everything that I need to let you know. Thank you to everyone that's subscribed to my channel, that's liking my videos and sharing, and also for everyone that is commenting. I'm very happy to receive your comments, and I do my best to reply to you as quickly as I see them. So please do keep them coming, and if you haven't subscribed to my channel, then I'd really encourage you to do so. My channel is all about giving advice about pregnancy and birth and beyond. So do like and subscribe if you are interested in this. My background is that I'm a midwife. I'm also a mum of 3 boys, so I will be sharing my advice based on my experience as a midwife, and also sometimes my own personal experience as well. So thank you so much everyone that's subscribed already, and I enjoy doing these videos, so it's really encouraging. So yeah, let me just get right into the video. So I'll start off with what to expect first from the baby. Once you've gone home, it's really important that you know that your experience in the hospital might differ a little bit from the being at home. It might be a little bit nerve-wracking in the beginning, just to think, oh my goodness, I'm no longer in a hospital, I can't pull a bell, I can't call anyone to just come by pressing a buzzer. But really do take that in your own stride, because it just means that you are ready and you are capable of looking after yourself and your baby. So take it in your stride and just really enjoy being at home, especially the first few days, because it does go really quick. So the first thing to expect is from the baby is a lot of sleepless nights. Your baby will be very, very active, waking up to feed during the night, and also it'll be very, very tiring for yourself and also for your partner. It's always important to just also make sure that you know that this is quite normal. The reason for your baby waking up during the night a lot is to make sure that they're stimulating your breast milk. If you've decided to breastfeed your baby, then it's vital that your baby wakes up to feed on the breast. What happens is you've got a hormone called prolactin in the brain, which is in charge of making your breast milk. And in order for this breast milk to be made, there needs to be a demand. And a demand is through purely from the baby's coming onto the breast to demand the breast. And this will fire up all this the hormone to make sure that, okay, yep, we've got a baby, we need to feed the baby. So it's very important the baby comes on to feed. Most babies will wake up every hour, sometimes every hour and a half. In most cases, or some cases, they can wake up every half an hour. This is really common and is really normal. It's not every time the baby wants to come on because they're hungry. It's because they're just being told to go on by Mother Nature. So this is quite tiring as well for your baby as well as yourself. So it's really good to just be kind, just to be gentle, and what you then need to do, or what it means, is that you've heard the saying before, when baby sleeps you sleep. So it just means that during the day when your baby is asleep, please try to rest. Don't spend your time trying to clean, trying to tidy up. It's very difficult for mums who have already got other children. For example, if they've got toddlers, they've got children of school age where they need to possibly do school run even within the first 5 days, then I do feel for you, because it is difficult to be up all night and waking up to also look after another child if you do not have the help or the support that you can. So within the first 5 days, I would say definitely get as much help as you can, in a form of, if you have good friends, if you have your parents, partner's parents, sisters, brothers, cousins, anyone that you feel comfortable to be around to support you, then that would be really great as well. In terms of breastfeeding, it is normal to experience some pain during your first few times that you're trying to latch baby on, trying to feed the baby. Baby will be on the breast a lot, like I said. So if you don't get the positioning and the attachment correct, you could be really, really sore within the first day or two, to a point where you don't even want to attach the baby. So it's really important that you learn how to attach the baby on the breast and get baby to latch on the correct way. And please don't, worry if baby is not on right and you're in pain. Do not be afraid to take baby off the breast and then reposition and attach the baby, okay? Because we want you to be comfortable, and the least pain, the better. The reason for feeling pain is normally when the baby goes on for the first time, your nipples are really, really sensitive, your breast is really sensitive, and it's just not used to being sucked on by a baby. So it's quite normal for you to feel a little bit of a nippy when baby first suddenly grabs on. We don't we don't want baby to grab on just to the nipple. We want baby to get a bit more of the darker side of the nipple, which is the areola part. I will make a video on how to do breastfeeding, how to latch and position baby on correctly. So as long as you're getting this right, it shouldn't be too much, but you do expect it, because it's not all just really nothing at all. You will have some discomfort, some pain. It shouldn't be a long lasting pain. As soon as baby goes on, starts sucking, it will be a bit nippy, and then as soon as baby stops sucking, a rapid fast paced sucks and slows down in a sucks, this should be not painful. This shouldn't be painful. It should be more enjoyable, more comfortable. You should see your baby's cheeks are filled. You should be probably hearing baby swallowing the milk as well, and you see that it's very comfortable and very pleasant. So if you're not comfortable doing this and it hurts too much and you're constantly in pain, sort of toe curling pain, screaming, shouting, or like any sort of vocalizing any pain, then it's most likely that it's not right. So do take baby away and put baby on again. The other thing to expect definitely from baby is the baby's poo. Baby's poo is very, very dark, is very sticky. It's called meconium, so it's dark green, very, very dark green. This will certainly change in the next few days up to the day 5, where it tends to go to yellow color, or at least mostly yellow, and then maybe a little bit of green or lighter green mustardy color, which is very, very normal as well. So do expect the black poo. Is quite common, is very good. It's just the lining of the substance that lines the baby's stomach, and when you're breastfeeding, breast milk has a little bit of a laxative effect, which is the colostrum in the first few days, which helps baby to clear all of that out. So it's very good for baby to do all this black poo, and is normal and is to be expected. The other thing to expect in not all babies is also jaundice. Jaundice is something that it comes during the first 2 days if baby's going to have it. It presents in a yellow tinge on the skin, which can make the baby look a little bit yellow. Also in the white side of the baby's eye, it can make it look the white part of baby's eye will be also yellow. So for darker babies with complexion as mine, or even darker, their skin may not look yellow because it's too dark for you to notice, but you certainly notice it in the eye of the baby. So the white side of the baby's eye will be yellow. It's always the last part to go, however, so do not look at that to think, oh, is it getting worse or is it getting better? Jaundice is normal. If it's normal to a point where if your baby is acting normal, baby's eating well, pooing well, weeing well, really active and good terms. When you're taking baby's clothes off, babies normally tend to wiggle their arms and they don't like it. They'll be crying. They'll be like, what are you doing? Put my clothes back on, kind of reaction. So this is quite normal. So if your baby's jaundice and they're still doing all these actions and presenting these things, then it's nothing to worry about. Just feed the baby, and as much as baby poos, the more the jaundice will go, because that's the only way that it gets rid of it. If you're lucky and you have a little bit of sunshine somewhere, there's a bit of sunshine here today in London, so I'm just here in the park. But if you have like a day like where there's a lot of sun, put the baby's cot by a window where the sun is shining through, and that could help break down bilirubin a little bit as well. However, if your baby's got jaundice and baby is doing the opposite of all of this, so baby is really floppy, really lethargic, is not purring as much, not weeing as much, not eating, baby is really hard to wake, and then you see that the jaundice is getting yellow, the yellow in the eyes is getting more, the skin is getting more yellow, baby's become really floppy, not really responding, it's really difficult for you to wake up baby to eat, then I'll recommend that you take baby back into hospital to be seen by a pediatrician. They can just test baby's bilirubin levels in the blood really quickly, and just give you advice on what to do next, if it's to do with baby needing treatment, or if it's just a matter of just carrying on at home and feeding baby more often and regularly, and just that should go. So do expect some jaundice because most babies will get it. Okay. The other thing to expect is the midwife's visit. So the midwife will normally come home to you, in most cases the first day after you've gone home will come to you, and also the fifth day you've come home will come to you. On your first visit from the midwife, we will discuss with you about breastfeeding. We will answer all your questions that you may have. We'll make sure that everything is going well, you are well, baby is good, and also that we give you as much support and help as possible. Make sure that you are okay and you've transitioned from hospital well to your home. The second visit that we do, however, is more informative and is more about doing things for the baby. The first thing I will do on your day 5 visit is we will weigh your baby. We do weigh the baby on day 5 just to see how our baby's doing. We expect some weight loss, anything between 5%, 2%, but up to 10% is normal to lose. So if your baby's lost less than 10% of the birth weight, then we don't worry too much about it. If it's more than that, then we will refer you to go back into hospital to be seen again, and they'll take it from there. The second thing we will do on your day 5 visit is we will do a heel prick test. This is when we will do we will use this little needle. It comes in a little pocket. I'll try and insert a picture if I can. We will prick the baby's heel, and we will collect just 4 dots of blood spot on a special made card to send off to go and get some tests done. This test, you should get your results within about 5 to 7 working days. If everything is okay, you get it in a post. And also, we will also, if there is anything wrong, they will call you. The other thing to expect is when your milk comes in, you will feel a little bit of a feverish, cold-like symptoms, flu-like symptoms. You can take paracetamol to help with this. The other thing that you can also do to help is also to use a cabbage. This is from personal use, and it's really helpful, and it helps with all the swelling, all the aches and pains that you get with the milk coming in. So what you do is you get a cabbage. Try to get this maybe before you deliver. If you've already delivered, maybe send your partner out to get it for you if you're experiencing this right now. But take a cabbage, take off the cover, the stem part of it, peel the leaves off and stick it in your freezer. Once it's frozen, you can take these leaves and stick them in your bra, and it helps to reduce the heat, the swelling, the hotness that you feel on a day 5 when your milk comes in. And it's a really nice natural way of relieving. For women that say they don't like to use any pain medication, then this will really help. Or even if you're taking pain relief, it will also help to relieve and to give a little bit of a edge off. So yeah, definitely try to use that as well. That will really help. Also, what you can expect to do is maybe some hand expressing when your milk comes in. So sometimes it comes in as a lot of milk and it's really difficult, really sore. What you can do is just hand express some bit of your milk to help make baby go on the breast really easily, and also to relieve a bit of the tension and the pain in the breast, and that will really help as well. I will make a video on how to hand express as well coming up, so keep an eye out for that. And now I'm going to just move on to what to expect for mum as well in the first 5 days. Okay. So what to expect for mum in the first 5 days. Number 1 is bleeding. Bleeding is very expected. Following the delivery of the birth, the placenta site, which is where the placenta was attached to the lining of the uterus, the womb, is now come away. So there'll be a space there where the blood will be coming from. So the blood will be coming from the area where your placenta was attached to inside the womb. It's normal to bleed for up to 6 weeks. However, the first 2 weeks will be the most bleeding that you will get. It's quite common for women to say they've stopped bleeding or the bleeding is reduced just after a week. And certainly by 2 weeks, they may be having some bleed once here and there, kind of thing. But it's not uncommon as well to then go to the bathroom maybe 3 weeks post-delivery, and when you go you find some bleeding. This is really normal. This can carry on for up to 6 weeks. However, after 6 weeks you may start to have your menstrual cycle return, where you get back to what you usually were before you became pregnant. For some women this may take a while, especially if they are breastfeeding. However, it's not recommended that you take it as though you're sort of safe from becoming pregnant again, because you are breastfeeding and you're not experiencing any periods, because you can still ovulate. So please do take care of that. So number one is definitely bleeding. Okay, the next thing to expect is swelling. So it's quite common to have some swelling in the legs, feet, and possibly hands as well. Towards the end of your pregnancy, you start to notice that you had a bit of puffiness to your feet, to your hands, and this can carry on. Certainly, definitely in your feet, you may still have some swelling. This is really common and is normal. The swelling does tend to go down day after day, and hopefully by the time you get to about your first week, end of your first week to the beginning of your second week, the swelling should be subsequently either gone completely or just really, really minimum. So don't worry about that, and that's really, really normal as well and common. The other thing to expect in your first 5 days for mum is definitely sleepless nights. Okay, as I said in the part for the baby, what to expect from the baby will be awake a lot during the night, and this means that you will have sleepless nights. It's very, very important that you are aware of this and you expect it, because it then makes you more prepared to take it all within your stride, to be happy to be awake, and therefore you can prepare yourself to sleep during the day and not do anything else rather than sleeping. So sleepless nights is very, very common. Your partner may also experience this. What I would recommend is maybe take it in turns where your partner sleeps for certain parts of the night and you deal with feeding. If your baby tends to sleep a little bit more during the early hours of the morning, so that you can sleep and your partner can maybe take charge of baby when baby wakes up, give you a little bit of extra time to relax or to sleep when he's changing the baby's nappy, maybe occupy baby for a little while by cuddling baby, just to give you a little extra 20 minutes at the end of the night. So do take it in turns, get your partner to help. If you are the partner and you're watching this video, please do support your partners in helping to change the baby, helping to burp the baby during the after the feeds, and wherever you can chip in just to get your partner to sleep. And certainly during the day, if there are things to do around the house, I would say partners it's your opportunity now to take charge and to help with either cooking, cleaning, doing the washing, looking after any other children that you may have. Take control more of that so that mum can have a lot of rest during the day, because it's very important that she does get this rest, because being up all night and to be up a lot as well during the day will take its toll. It will not last very long before mum becomes really affected by this. So it's very important that she does get the amount of sleep during the day that she can get, because she will be up during the night. So this is where you come in. Another thing to be aware of for mum is also just in general having a little bit of a not so clean house or environment. So do expect that you are not going to be able to do everything. So do not try to do everything in terms of looking after the house, looking after baby, looking after toddlers, children, other children around, or anything else, and also expecting to have an immaculate looking house. It's okay to just let the house go down a little bit whilst you are getting your feet and sorting out the first 5 days with your baby, trying to bond and just trying to do all the important things that are more more important. Okay, so do please be gentle on yourself, be kind to yourself. You've just had a baby, which is an amazing experience, amazing thing that you've just gone through, and it does have an effect. So do take your time to recover, take the help that you can get from whoever is offering it if you're happy to do so, and prepare yourself as well beforehand. It's also important that maybe before you have the baby, or if you've had a baby now, get people that are coming to visit you to bring in maybe some food that they've made. So do accept help. If you've got a mother or a grandparent that wants to prepare you some meals for a couple of days, please just tell them to bring it to you if you don't mind at all. If you're gonna have guests that are coming, I'll recommend that people will come and to help rather than just coming for you to feel like you have to entertain them. Having to be separated for a long period of time from your baby because everybody wants to cuddle the baby. So people that are coming should be maybe coming to do more like helping you with your dishes, helping you with cleaning. Apart from seeing the baby and seeing how well you're doing, it's always helpful if they come to bring in some support and an extra pair of hands to help around the house as well, so you don't feel so much like you have to do all of that when you could be resting. Okay, so do be prepared and expect a little bit of the housework just being out of your hand and out of your control for a little while, and this is okay as well. Another thing to be expected of is some pain during your breastfeeding. So when you're breastfeeding your baby, your uterus, which is the womb, will be contracting. Okay, it's not so much for mums who have just had a first baby. It's more for when you've had maybe your second baby, your third baby, fourth baby. Certainly when you've had multiple children, it's more harder for you and is more noticeable when you are breastfeeding to feel these pains. It's called an afterbirth pains. It's not really talked about a lot, but it is very important that you are aware of it, because you can be quite shocked and think, oh my goodness, what is this pain that I'm getting? It's similar to the pain that you get during your contraction. So the contraction pains, if you were not in labor and you had maybe a planned cesarean section and you're thinking, oh, I don't know what contractions are like, think of it as like your period pains. It's similar to having a period pain when you are having these contractions. Okay, a little bit more than the average period pain, but this is normal as well. It doesn't last for very long, maybe between a week or so, maybe 3 to 7 days, shall we say, depending on how many times you've had a baby before. So it's quite normal and it is to be expected, so do look out for it. You can always take paracetamol to help with that pain. It's very, very helpful. Okay. Another thing to be expected of is just generally your emotional well-being. The baby blues, I'm sure you've heard of it. This is really, really real. It does happen to quite a number of people, and it doesn't mean you're doing anything wrong, although for you feel like you are doing something wrong, or you're not doing your best, or you could be doing better. This is quite normal. Okay, around about the day 3 is when it mostly appears. Around day 3 to 5 you start to feel like, oh my goodness, this is really overwhelming. I'm doing so much. Is everything going well? Am I doing the best I can? Or you may feel entirely like you are not doing absolutely the best that you can, although people around you will see that you're doing the best and you are doing the best. So just know that this is all hormonal. It's really normal. It's just your hormone dropping suddenly from being pregnant to not being pregnant anymore can take its toll like that emotionally, and you will burst into at some point a cry. It may be really sobbing, and people are thinking, well, what's wrong? And you think I'm not making sense, or it might be quietly crying to yourself or feeling really overwhelmed, and it comes out in tears. This is really, really normal. I want you to be reassured that it is normal. It will pass. It's just a temporary feeling at the moment that does happen, and is also really, really common. The best you can do to to help yourself is maybe speak to your midwife that will come home to see you, or speak to your partner, speak to your general practitioner, your GP. Just speak to somebody that you are happy to talk to and you are comfortable in talking to about this, but don't keep it to yourself. If you feel it's going to help you to speak to somebody. The other thing that you can do is maybe you can write things down, keep a journal, how you're feeling at a certain time of the day, at each point of the day, how you're feeling, what is making you feeling down, what you can do to help, and to look back at it, you will know that, okay, this was normal if you do have other children later on. So it's quite normal if you are experiencing this. Okay. So I think I will end the video here. If you have any questions about anything else, please do get in touch, and Send me your questions. I'll be more than happy to answer for you as soon as I get them. um, if I've forgotten anything, or if anything else that you've had you want me to elaborate more on, then please again leave your comments down below and I'll be more than happy to reply to you. Thank you so much to everyone that subscribed to my channel, that is liking my videos and also sending your questions. If you want me to make any particular topic in my videos that you are really desperate to know about, then please do let me know and I will put that as a first priority and make that video for you. I'm trying so hard to make a video as often as I said I would, but it's pretty hectic right now with work and the children, so I'm trying to do as much as I can in a sitting. So I'll try to do 1 or 2 video every time I sit down to make a video, because I'm not finding the time to do so much as I had hoped. So thank you so much guys, and I will see you next time in my upcoming videos. Take care. Bye.